panel discussion is, the topic is innovative healthcare opportunities to serve an aging world. And certainly in all the conversation that we've been talking about healthcare, we've spoken about innovation, XYZ, but we have not necessarily touched on the aging, the aged community, which is a huge topic that is often overlooked. Earlier, Dr. David Walcott, who also sits behind Novamed as the founder, was the moderator for the panel discussion with Dr. Carissa Etienne, and now he will serve as the moderator for this particular panel discussion. If you just joining us, you didn't have the opportunity to hear his bio, but he speaks about 4 or 5 languages and was coming for my job. But a medical doctor, an entrepreneur, a founder, managing multi-million-dollar different business and companies across the region. Certainly a great mind, but also a great doer. So I'm going to throw it over to Dr. David Walcott to not labor the process anymore, so that he can take us away with the next panel discussion. Over to you.
Thank you very much, Terry, and really happy to be having this conversation here. We've been speaking a lot about innovation, and I think it represents the fact that our world is very sort of forward-looking and values youth and the pursuit of eternal youth, which makes this conversation even more timely with the challenges that our older populations have faced during COVID-19. And so I'm extremely happy to be hosting this conversation with a group of distinguished guests. And I'd like to introduce, first of all, Debra Whitman, who is the Executive Vice President and Chief Public Policy Officer of AARP, which is an organization that leads policy development and research and really advocacy for older persons across the United States. Debra is the co-chair of the Global Future Council on Healthy Aging and Longevity. And Debra has been featured extensively in several prominent news outlets, New York Times, Bloomberg, etc., and is also on several boards, including the NIH's Institute of Aging and Columbia School of Health Aging Board. I'd like to also welcome, and it's very difficult to introduce everyone because everyone is so distinguished. I'd love to also welcome Maliha Hashmi, who is the Executive Director and the Deputy Sector Head of Healthcare, Wellbeing and Biotech at NEOM. Maliha is also extremely well achieved and distinguished. She's also on the GFC for Health and Healthcare at the WEF, and has been recognized as one of the top 7 most talented emerging female health leaders of the MENA region. So welcome to you as well, Maliha. And of course, I'd love to welcome Alex Kalache, who is a medical epidemiologist, chiming in from Brazil. Bem-vindo, Alex. He's president of the International Longevity Center of Brazil and has had an outstanding and lustrous career, formerly directing the WHO's Global Aging Program in Geneva. So welcome to you all, and very happy to have you. As I had mentioned, COVID-19 has really been particularly challenging for older populations, and it's important to realize that our global population is aging at a significant rate, whereby we're expecting our number of older persons in our population to double by 2050. Let me start this off with you, Debra, given your sort of helicopter eye mandate of what aging looks like globally as the co-chair of the GFC's Council of Healthy Aging and Longevity and the Chief Public Policy Officer of AARP. What trends are we seeing globally regarding aging that the global world needs to start speaking about?
Well, I guess I'd break it into 2 points, pre-pandemic and now. Many of the issues that were big issues pre-pandemic have really come to the forefront. The need to make sure that we're caring for a growing population of older adults and including them in society. the need to make sure that our healthcare is addressing the needs of the community, not just treating sick care. And then post-pandemic, in the United States, 81% of the people that have died from COVID are older adults. And I think going in, and I'm sure Alex, being a geriatrician, we all knew that this was going to be a problem. And really across the globe, so few places were able to put into place the basics for infection control in long-term care or home care facilities, to think about workforce issues and how do we support the people that care for the people who are older. So I think coming out of the pandemic, there are a lot of lessons to learn. We have older people in the community. We have older people with needs. We have older people that can help. And we need to make sure that our plans for the future include an aging society and that address the needs of people as they age.
Of course, absolutely, Debra. And you make a good point in that the sort of responses and resources that have been put into place have differed region by region. And, we're seeing where we have sort of global viewership, even at this event. I'm going to ask you, Maliha, from your perspective, what has the sort of response been like to the pandemic for the older persons within the MENA region?
So it's a very interesting time. It's a very difficult time, but also an interesting time for innovation. Because when you talk about, just the aging population and you talk about the innovators now, there's a difference, and difference connect in terms of behavioral change. And sometimes you have to do that where you have virtual connectedness, virtual care that was needed for a long time to have a more integrated system. But what the pandemic has done is people that were not receptive to technology became receptive to technology. There are people in the MENA region that, use their iPhones all the time, but now there are apps in there where you can get connected to virtual care, which they never thought of using before. But this sort of was a catalyst to them using technology further. And technology became that much more important because when people were so physically apart, they had to be socially connected and interconnected. And I go back to a discussion we were having earlier, another private discussion amongst you, with you were there, is that a very important part of aging is to have social connectedness and interaction. And what COVID has done is made a lot of people physically distant and disconnected. And what has happened in the MENA region is people have become that much more receptive to using technology, be it FaceTime, be it Zoom, be it any other mechanism of technology to connect to the loved ones, as well as connect to virtual care, as well as connect to even emotional support services, which was not a norm in the past, but this became more a norm now. And we saw changing behaviors in the aging population, not just in one country, but a couple of countries in the MENA region. And so in one way, it has been a crisis in many ways, and it's a difficult time. In another way, it's been a catalyst for change, for people to adapt to new technology, and it is humanized technology, which was not the norm in the past. So behavioral change was a really obvious sort of indication that people are becoming receptive because of a time of crisis. So we have more aging populations, but you also have people more receptive to technology now. And that's become a very big topic of discussion in the MENA region.
Absolutely. And, you make a good point in that COVID has forced us to, develop a greater level of engagement with technology. Unfortunately, in certain regions, again, there are persistent divides between the ability of older persons to access technology, and the so-called digital divide remains. And one of the primary sort of macro regions is Latin America. And so I'm going to chime into you, Alex, to share your perspectives on the sort of key trends you're seeing in aging and how the COVID pandemic has really affected our regional group of older persons.
Thank you, Dave. It is really extremely challenging. We are, Latin America, the epicenter of this crisis. It was predictable, and there was very little that our so-called leaders have done to address the issues. The first thing that I would like to say is that we are living a longevity revolution. You look at me. I was born in this country, I'm talking from Brazil, with a life expectancy of only 43 years. We have now reached in Brazil 77, and there are neighbor countries like Chile, Argentina, Uruguay, and others with a life expectancy of around 80 or plus. So it is revolutionary. Revolution is something that happens all of a sudden in a society. That society will never be the same again. Within that, we have not only a digital divide, we have a divide. We have inequality. We have people that have access to the best possible care in the world. But this is the elite. What I'm concerned is what can we do to help people that are already in old age or are aging with the famous comorbidities that make them much more likely to die from COVID. We are approaching 300,000 deaths. And I call attention of all of you. We are still not as old as Spain, Italy, or France. If we would have the same demographic structure of developed countries, we would be with twice as many deaths. This is the extent of the problem. There is one aspect, David, that is absolutely critical. If our leaders don't have science understanding, and as in Alberto Camus' The Plague, he reminds through the personal protagonist of the history, Dr. Hu, you cannot deal with a pandemic, you cannot fight a pandemic without decency and health and science. These two words combined means that we have a divide that is also in terms of health illiteracy, science illiteracy, and we are still here listening to our leaders talking about chloroquine, don't need to wear a mask. So there is a long way to go, and I think that it's going to be a disaster. I agree entirely with them that we can divide, the pre-pandemic and post-pandemic. We don't know yet where we are going and when we are reaching this post-pandemic. But I have to emphasize, developed countries first got rich and then got old. We are getting older much faster without the same resources. So when we talk about innovation and technology, we still have to focus on the basics, primary health care, to be present where the communities live. And I commend WHO for launching the decade on healthy aging, because many of the issues will be central to the agenda that WHO and now encompassing the whole United Nations, because it's not only at WHO, it is across the border, the whole United Nations family responding to the challenges of aging.
Absolutely, and we think it's it's very opportune that the decade of healthy aging actually started in a year where the lives and livelihoods of our older persons have been changed so much. And so I'll pose a question that Alex alluded to you, Debra, in that how do we identify opportunities to solve for the persistent inequities that have been unearthed by the COVID-19 pandemic?
Thanks, David. And I want to be clear that the inequities are across country, but they're also within countries. So in the US, Alex was talking life expectancy, but we've got a 10-year differential between the top 1% and the bottom 1% for women, and a 15-year differential in the amount of years that somebody in the top 1% who is a man can expect compared to the bottom 1%. That's a lot of time with your family, time to give back. And so we need to look at ways to address these inequities in the United States also, the inequities of COVID deaths have been particularly focused on multicultural communities here in the US. So life expectancy overall has dropped in the US by more than a year in the first 6 months. For Hispanic Americans, it dropped by 3 years. For Black Americans, it dropped by 2 years. We need to do a lot. And it isn't just this virus that seeks out people differently. It's really the communities that they live in, the abilities of them to protect themselves, either because they are essential workers and are going out, or live in multi-generational homes because of high home prices, or don't have as good access to healthcare, or have to use public transportation. All of those things exacerbate the health inequalities. And if we truly want to have healthy, long-lived societies, which I think really should be everybody's goal, then we need to look at ways to lift up the communities that are lagging behind. And a lot of that is public health. So many of our countries have ignored the basics, have not focused on the areas that most need addressing. And I'm hoping, as we think of what comes after the pandemic, that we actually are more targeted. I know the Biden administration has already released plans focused on communities of colors, be it in vaccine distribution to increasing additional resources in public health. Those are the types of wake-up calls that I hope COVID provides, and that help us long-term. I also think the private sector has a role, and I know we'll talk about that a little bit more later, but certainly, as Maliha had talked about, there are ways that can be more democratized, that get people access to the care that they need, be it telehealth, or by looking at the social determinants of health as a piece of healthcare. So how do we make sure that we don't just treat somebody's pneumonia and then send them back into a poor housing situation, but we make sure that that house is safe and that there's food in the kitchen so that they can keep themselves healthy. I think the private sector is starting to understand this combination of the social determinants as well as the physical determinants of health. And that will be a revolution. I think that won't just affect older people, but it'll affect all sorts of people.
Deb, and you dovetail into the sort of next sort of key space we'd like to explore, which is how do we create a multidisciplinary approach to solving for the needs of older persons, solving for the sort of mental determinants, mental health determinants, solving for loneliness, solving for the social determinants, and of course solving for the physical conditions that are more prevalent in older populations. Maliha, what are your thoughts on how we can sort of generate a cross-disciplinary dialogue to solve these challenges?
That's a great question, and thanks for asking that. I think one of the first starting points for everything is awareness, and it's having that awareness across different stakeholders and the likes. And one of the most important elements, we talk about, care, and how do we cater to it to everyone. It's really changing the design and system of thinking of what really care is. And we talk about inequities, we talk about the differences, we talk about the challenges, and it all really goes down to breaking those silos. In silos in healthcare, silos in getting access to care, and there's a whole continuum of care. We also talk about an aging population, but we need to start from the beginning. We need to start from the cradle to the grave. How can they have access to care in a continuous basis where every single silo is blended and it's one continuous integrated system where all stakeholders are aligned and involved? It involves having a proactive approach, not a reactive approach, and developing a system where public health, mental health awareness, private care, everything is in one continuum of care. the aging population will be much healthier and happier if we start investing in them from the start. And so we start investing in also the healthy young people, and they will be aging as well. They will grow older too. So we have to have stakeholders involved in all steps of the way, from the youth all the way to the aged. And when we have that involvement and that dialogue in place where there's no silo, that will be really the innovative design that we will be creating, where everyone from every spectrum of care and every spectrum of the life cycles will be there involved with us. And I think one of the biggest challenges for some is, how do you break those silos? It's from dialogue, it's from discussion, but it's also immediately not putting buckets of specific thoughts that this will be really just for the aging population. So we need to focus on that. It's starting with the youth and going all the way to the aging population. And once we start viewing it like that, it will be a much broader approach, but it will be a healthier approach, because then everyone will be involved in that discussion. Just this conference and other dialogues in general, I'm so happy and excited that longevity is a subject that is being discussed. Aging is a subject that is being discussed. We all will be growing old. We all will be getting there, but we need to talk about it now and be aware of it now and start those behavioral changes, start those discussions now so that it gets better for us. But for those who are there, we need to have that discussion as well. So I think the most important platform is a platform of dialogue amongst those stakeholders, but also understanding that silos have to be removed in different levels.
Yeah, absolutely, Maliha. And you made a good point in sort of highlighting the need for removal of these silos. And one specific silo that has persisted in the narratives around aging is that serving the needs of older populations is really a public sector mandate, or it's a developmental sector mandate, or it's a social net mandate. And we heard coming from you, Deb, that the private sector needs to become more actively involved. Now, how do we reconcile the needs of our older persons with the fiduciary objectives of the private sector, and what opportunities lie within that sort of common ground whereby the private sector can meaningfully engage in serving the needs of our older populations in a way that serves their priorities? Mm-hmm. I'll pose that one to you, Deb, and then I'll hear thoughts from Alex.
Mm-hmm. Sure. Thank you, David. And I was just going to say, I think self-interest goes a little ways. I think the ability to actually make money also goes a long way with the private sector. So we released a report last year that looked at how big of an economy people over age 50 are in the United States. And it's $8.3 trillion of spending. It would be the third largest economy in the world if you just took people over age 50 and had them be one country. But more importantly, in the healthcare sector, people over age 50 in the US count for 55% of the sector's GDP. And so it's not just that they need to be benevolent to take care of older people, but solving the needs that people have is actually really, really good for business. And when I say solving the needs, it's you need to ask the person what they need, not just sort of institute what you think people as they age need. And I just want to shout out to Maliha's point. We view aging from a life course perspective. There are people with health conditions in their 20s. There are people without health conditions in their 70s. But if we treat everyone as healthy, or we treat everyone as going to be sick, then that's not a great viewpoint either. And so I think the healthcare system has a lot of room for growth and innovation to better serve the needs, and then also to make a return and to have a good business. So I know you have a lot of people listening, but that are from all different sectors. It's not just that you want older people as your consumers. But I also hope the companies look at their workforce and think about having a multi-generational workforce that actually knows the needs of their own population and strives for innovation within the workplace itself.
Absolutely, absolutely. And very good point, Deb. I know Alex in particular has done quite a bit of work on intergenerational connections towards solving the challenges really across the entire health span. And so I'd like to hear from your perspective, Alex. How do we sort of harness the human capital to be unlocked across and within these different generational segments to really provide and ensure that as a whole our population has well-served needs as it collectively ages?
I think that all the points that we have raised so far are interconnected. First of all, we have to understand what Deb has just said, that, in order to have money in your hands, you almost have to be 50 plus. That is where the wealth is concentrated. If you want to buy a new BMW, Dave, you don't have the money to do that, or maybe you have, but most people that are under 30 don't. So, first of all, you have the consumers, and they're getting older. It's the same in my country. But then you have a colossal amount of people that are not aging well, which is my point about the life course. Except that I would like to correct one thing that you said. You said that we are all in the same boat. No, we are not. Some people will never reach old age because they die prematurely, mostly because of the social determinants of health. I live in a country that everybody has got a smartphone in your hand. Everybody. But 50% of the population will have a smartphone in your hand and the feet on the sewage, because there is no sewage for 50% of the population. So this divide is tremendous. And it is combined with a very strong race component, gender component. We have seen this within the context of what has just happened and is happening, the COVID. Women are much more likely, not necessarily to die, but to care, to have to leave their jobs because they have to look after their children, their parents, their grandparents, and maybe their husbands because they have the bad habit of getting married to an older man. That is a campaign for you to promote. Women, if you're not married, choose a younger man because you have a life expectancy that it is so much higher. You don't want to be a widow and in loneliness in your old age. So all these things are combined, and I would like to express another point. It's not only in terms of life expectancy, that that it's not only that, within the same quarter. When I work at the New York Academy of Medicine, from my office, I could choose to look 2 kilometers away to the left, and I would be in Upper East with a life expectancy of 90, or to look 2 kilometers away to the right and end up in Harlem with a life expectancy 20 years lower. But it's also in terms of health-adjusted life expectancy. You may reach 60 or 70, but with so many diseases and disabilities, that is almost not worth. And the last point that I would like to say is that the private sector has to be part of this whole discussion. Absolutely critical. It is too complex to leave only in the hands of the public sector. That is one of the strengths of the movement that I launched as director of WHO, the age-friendly cities and communities that is now spread around the world. The best examples are when the private sector is fully involved. And in saying that, it's also a challenge for the education sector. We live in a very ageist society. We have made some progress, but on the whole, it's what Angela Davis says about sexism. No, it's not enough not to be sexist. You have to be anti-sexist. It's not enough not to be ageist. You have to be anti-ageist. And that comes down from school. And your question about intergenerational age is right here. we live in silos. The young don't mix with older people. We live in nuclear families. The young people in the same family don't have connections with their own grandparents. And then when you come to universities, you are trained not looking at the aging process, and not learning enough about aging. This is ageist. The curricula of our universities are training health professionals, for instance, for the 20th century. They learn everything about babies and child development and pregnant women, and they will end up having to deal with old age without having learned enough about anatomy, physiology, pharmacology, and so on.
That is what we're hoping to change, Alex. That is what we're hoping to change. We have, lots of participants from the public sector, private sector, development sectors, and we're really hoping that this message resonates. And so I'd love to thank you all for being here again. Thank you so much, Deb, for tuning in. Thank you so much, Maliha, for tuning in from the Middle East. And Alex, obrigado por estar aquí. Thanks again, guys. Handing back over to Terry.
All right. Thank you so very much. Dr. Walcott did a fantastic job at moderating there. Those great discussions. My grandmother just turned 89 last year. Hopefully in November she'll turn 90. So I appreciate the conversation about our aging society and how they interact with healthcare, or how healthcare interacts with them. So we move to the very final panel.